Hello, I'm Sarah. I'm Dr. Johnson's assistant on the internet. I want to talk about ear infections in dogs, which close up the dog's ear with thickened scar tissue. Once the ear is closed up, it's almost impossible to get medications deep into the dog's ear, which makes treatment extremely difficult. The first thing to be done is to reduce the scar tissue in the opening of the ear canal. This is sometimes done with medications by mouth, including steroids and antibiotics. This is an important piece to fixing this type of dog ear infection because without the medications by mouth, the swelling is unlikely to subside down inside the ear canal. If the veterinarian gives a high enough dose of steroid, and the owner is diligent about getting at least some medication into the ear canal, it's often possible to get the ear canal to open up enough to allow better and deeper treatments to be applied. If there is a concern that the ear infection is caused by a dangerous or highly resistant bacteria, a veterinarian may decide to grow a culture of the germ in a laboratory setting. The hope is that if we find out what is growing inside the ear canal, we can figure out what medicine we need to use in order to kill that bacteria. If an ear canal has scar tissue so bad that it's closed up the ear, it's always a very good idea to grow a culture of the offending germs. Some veterinarians know about a compound called Silvadene Cream, which is an ointment that spares almost no germs of any kind. This is a prescription medication. Once the ear canal opens up, owners or veterinarians can sometimes get this medication past the scar tissue and deep into the ear canal. Silvadene Cream practically sterilizes the ear canal of the dog. An owner can alternate with Silvadene Cream and then a thorough ear cleaning with a wash made with betadine or even chlorhexidine. Yes, it is a lot of work, but to salvage a dog's scarred ear canal, it is necessary. Sometimes in a case of scarring ear canal in dogs, there are secondary problems which may arise. One of these is steroid dermatopathy. Steroid dermatopathy is a very rare condition where so much steroid negatively impacts in the skin that the epidermis loses its grip on the dermis. The steroid causes a dystrophy of the basement membrane, and the most superficial layer of skin peels off in multiple areas. And that is what this is. The use of so much steroid in a patient that the epidermis peels off, exposing red, oozing raw skin. If this happens, you have to stop using a steroid in the case. This makes treatment extremely difficult, maybe even impossible. If you've got a canine patient with an ear canal that's scarred until it's actually closed up, here is a summary of the best practices from Dr. Johnson's experience. You may decide to grow a bacterial culture of the nasty germ growing in the ear canal. First, open the ear canal with oral medications to include a steroid and an antibiotic. Steroids could also be given with an injection. Disinfect the ear with alternating treatments of Silvadene Cream, and then a betadine or chlorhexidine solution. Once the ear canal is open, you can pursue deeper treatments with more conventional ear medications. Sometimes the bacterial culture will direct the veterinarian in another direction. If you encounter a steroid dermatopathy or dystrophy, your treatments may be compromised. There is a surgery which is performed as a last resort. That surgery is called ear canal ablation, which is the surgical removal of the ear canal. Sometimes, the surgeon will even remove deeper structures which have been compromised. This surgery is performed by veterinarians with a specialty in surgery. Your veterinarian may arrange referral to such a veterinary specialist if this is the best course. This may actually be the best option if a dog is sensitive to steroids and cannot take them. I'm sorry if your dog is faced with this problem, and I wish you all the luck in the world with it.